Signe Spine and Rehab on Bowman Road in Mount Pleasant is taking a conservative approach to back and neck pain. Today, I talk one-on-one with interventional spine specialist with Signe Spine and Rehab, Dr. Dan Nehmeth, for this edition of Quintin's Close-Ups. And if you haven't already, subscribe to my YouTube channel and like Quintin's Close-Ups on Facebook. Dr. Dan Nehmeth, welcome to Quintin's Close-Ups.
Excellent. Well, thank you very much.
Oh, you're very welcome. I know you obviously have your own business, Signe Spine and Rehab, which focuses on a conservative approach to back and neck pain. And I know that obviously you were formerly trained as an interventional spine specialist. Who is Dr. Dan Nehmeth these days?
Dan Nehmeth is a guy that likes to take a conservative approach to neck pain and back pain. We want to make sure that we're getting people back on track with their lives and diminishing pain if we can, but really restoring the quality of life.
As a matter of fact, I know your business's mission is to improve the patient's quality of life by eliminating back pain and restoring function, as you just mentioned. What's the quality of life for most of your patients?
So a lot of our patients, they come in and they do lead active lifestyles, but they're being bogged down by neck pain or back pain, and they're not getting to be as active as they once were. And we're really looking to get them back to doing the things they love.
If they love. And I know obviously your office is located right there on Bowman Road in Mount Pleasant. And I know that this is predominantly accomplished through specific spine physical therapy and when necessary, performing targeted interventional procedures. What are those performing targeted interventional procedures right now that are really popular with your patients?
So a lot of people that come in with back pain, it could either be due to disc herniation, and sometimes an epidural can be beneficial. Things that we do a little different in our practice would be we take a targeted approach to a specific nerve root. We do what's called transforaminal epidural, where we're targeting a specific level. People can come in with arthritic pain from the facet joints, and we can do facet injections or even do what's called an ablation, where we burn the nerves away to a joint.
Wow. And I know, obviously, this goal is to prevent unnecessary surgery, chronic opioid usage, and freaking non-specific procedures when possible. You call this the new victory in spine care. Let me ask you this. What results have you actually gotten from this new victory?
So I think that we've come to grow pretty quickly in Mount Pleasant because we do take a little different approach. We're not giving everybody an injection. We're not giving everybody a pain medication. We really are focusing on stabilizing the core through a learned home exercise program. And we're preventing injuries down the road. When necessary, we'll perform an injection. When necessary, medications can be used in the short term to kind of reduce inflammation or control pain. But it's really all about stabilizing the spine to prevent injuries and heal.
And what are those medications that are generally given to the patient?
We commonly, if we're going to give a medication, if the patient can tolerate it, we're going to give an anti-inflammatory. Anti-inflammatories reduce inflammation, which in turn can diminish pain. If someone comes in with severe pain, they've just herniated a disc, we may give a very short term of opiate medications just so we can get them over the hump. But we really try to avoid long-term opiate use due to its dependency.
Yes, sir. And obviously, we're still in the middle of COVID. Let me ask you this, Doc. How many of those posterior imbalances and structural misalignments have you heard as a result of COVID?
It's funny. We've actually seen a lot of people that were holed up for the last year, and they've gotten out of their routine, they've gotten out of their exercises, and they've become weak in their core. And because of that, they've now gotten back out and tried to do what they once were doing, right, and they get an injury. So we're getting pretty busy as the country's opening back up.
And obviously, you know these issues more than I do, but muscle loss and numbness, how many of those issues have kept your office actually busy?
I'm sorry, one more time. Can you repeat that?
Yes, sir. And I know that obviously you know more about these issues than most people when it comes to obviously, the back pain and other issues, but muscle loss and numbness, how many of those particular issues have kept your office actually busy during COVID?
I would say quite a bit. So muscle loss and just deconditioning has led to the core weakness, which has led to a back injury, and sometimes that radiating pain down their legs. I wouldn't say numbness as a whole is a big issue post-COVID, but the core weakness and leading to a back injury has been a pretty big issue.
Wow. And let me talk to you too about some other issues: muscle pain, slight stiffness, and general checkups. Have your office experienced any telehealth increase because of those areas and those issues?
We have, especially a year ago when COVID first came out, we were only doing telehealth, and we slowly have gotten back to get people in the office. It's really beneficial for people to get into the office, especially for the first visit, so that we can actually do a proper physical exam and diagnose the patient. But when it's applicable, we'll do a telehealth so that we can still maintain social distance. And if we just have to follow up with how an injection's doing, how therapy is doing, sometimes we can just touch base on a telehealth call.
And Doc, let me ask you this: how can chiropractic adjustments influence somebody's immune system by targeting the nerves that power a person's immune response?
So chiropractic adjustments can be beneficial for back pain, but there's many instances where I recommend against a chiropractic adjustment. I don't think there's great evidence that chiropractic adjustment can help boost an immune response. At least there's no level 1 quality research out there suggesting that. If someone comes in with a disc herniation, radicular pain, weakness down their leg, or a slippage in the back, what we call spondylolisthesis, I actually recommend avoiding the chiropractic adjustments, but certainly they can follow up with chiropractors for other modalities that they may offer.
And obviously, you talk about the immune system, but how can you take a look at someone's diet and suggest changes that can reduce inflammation while boosting their immune and injury levels?
Diet can play a role with inflammation. High fatty, high sugar diets can promote inflammation. So having a clean diet, low in fat, low in sugar, and making sure it's just a well-balanced, healthy diet can be beneficial. And there's also turmeric and other spices that have been proven to be anti-inflammatory. So these are over-the-counter things you can buy at CVS, Walgreens, Walmart that can help reduce inflammation in the body.
And what are those examples that you've actually heard from some of your patients?
When they've actually had a reduction in inflammation?
Well, when they buy those particular, over-the-counter medications.
And the over-the-counter medications can reduce inflammation. It's definitely proven that it can. But it's not going to be nearly as potent as your non-steroidal anti-inflammatories, such as your ibuprofens and your Aleve.
Right.
Those are going to be much more beneficial to reduce inflammation in the body, but not everyone can have that if they have a history of heart condition, kidney disease, stomach ulcers. That's when we recommend some of the more homeopathic approach, such as turmeric, where there's not as many known side effects, and it still has some mild anti-inflammatory effects.
Wow. Oh, yes, sir, absolutely. And how could you identify areas of the body that might be vulnerable to injuries?
So, and I wouldn't say I go searching for it.
Okay.
Patients are going to be coming in complaining of pain. And a lot of times people may come in with an MRI or with an x-ray. They may say, I have 5 bulging discs. The reality is we're all going to have bulging discs in our bodies. So I wouldn't say I go out searching for problems. It's people coming in complaining of back pain, radiating pain, and then we're going to address the issue through an exam, imaging, therapy, and possible target injections.
And I know earlier you said, hey, chiropractic adjustments, calm down on that just a little bit. But how then can those adjustments ensure that your body's bones, ligaments, and tendons are lined up properly?
We don't always have to make sure it's lined up properly. That's one key thing. A lot of times people will come in saying that they're out of alignment. The fact of the matter is nobody's body is built perfect, and we're almost all out of alignment. It does not mean there's a problem. So I don't get all excited if I see on an x-ray someone doesn't have a perfect curve in their back, because likely they were born that way and it's not going to be an issue for them.
Wow, never knew about that. Wow, that's amazing. And doctor, let me ask you this. Have you heard of any myopathic and neuropathic complications in patients diagnosed with COVID?
Yeah, we actually had a patient today that was complaining of myopathic generalized pain 3 months after having been diagnosed with COVID. It's a novel new virus that we're not we don't fully understand, but we are learning more and more about it every day. And a lot of people do have symptoms similar to the flu or influenza with the generalized myalgias. And we hope that as the virus runs its course, these symptoms will resolve, but we are seeing some of the effects linger on.
And what have you learned thus far about COVID and obviously back pain, spine pain, chiropractic?
So I'll tell you one big thing that we're running into now as many people are getting their vaccinations, which are significantly diminishing the severity and the spread of COVID. So it is very important that we keep getting vaccinated. But we have found that if we do an injection, we have to wait how close we are giving that injection to the vaccine, because my steroid that I'm giving will reduce inflammation and it can reduce the immune response. I don't want to reduce anybody's immune response to the vaccine. I want their body to make those antibodies. So there are these new things that are coming out that we're learning about COVID, the vaccine, and procedures we do in office as well.
Wow, amazing, amazing information. Well, Dr. Dan Nehmeth, thank you so much for your time. And again, welcome to the award-winning Quintin's Close-Ups.
Well, thank you very much for having me.
Oh, you're very welcome anytime.